common ito sa mga nurses na galing sa ibang hospital tapos pumasok sa iba pa, sa bagong hospital. Sometimes yung protocols kasi ng mga hospitals iba-iba. Pero they have the same goal, mabigay yung quality care. Pero kasi minsan sa pag-shortcut ng method or hindi natin sinusunod yung mga policies, yung procedures, in the long run, nagkakaroon ng problem. Kapag ganito kasi nagiging incidents. So, sa amin, incident reporting na ito kapag ganyan. Kapag hindi nasunod yung process. So, kailangan kasi minsan, simple protocol na lang. It's a discharge process. Um, Natagalan yung pasyente sa discharge process kasi yung nurse, imbis na sinunod niya yung process, may ginawa siyang iba na akala niya mapapabilis yung process ng discharge. So, dahil gumawa siya ng sarili niyang proseso, mas napatagal yung discharge process, nagalit yung pasyente. So, um, parang magiging problem na siya. So, ang action natin doon is to adhere strictly to the established procedures and protocols, depending on the institution actually. Particularly in medication administration, patient handling, and infection control practices. Again, from what examples na binigay ko recently, yung infection control practices, like yung kunyari, yung mga staff na meron ng symptoms ng COVID or ng Mpox, tapos pumapasok pa rin, it could risk all of the employees kasi. And yung risk na magkahawaan at maging kumalat po yung sakit, isa po yun sa deviation and standard protocols. In our handbook, here in Tri-City, we have a violation for that one. And it has specific sanctions kapag ginawa ito. Okay, failure to communicate, again, not sharing critical patient information with colleagues or other healthcare providers. It increases the risk of errors and misunderstanding. So, pwede siyang maging legal issue kasi pwedeng hindi kayo nagkaintindihan at iba-iba yung care na ibigay niyo. Okay, yan. Okay, so action nyo, kailangan keep clear lines of communication with all team members, especially regarding changes in a patient's condition, treatment responses, and concerns. So, minsan, ang failure to communicate natin, um, merong, meron, kunyari, precaution yung pasyente, hindi mo nasabi dun sa mga ibang healthcare worker like laboratory, radiology, then na-risk sila or na-expose sila. So, isa po yun. Inadequate staffing naman can potential be a legal issue kasi understaff. Ah, Well, yun ang pinaka-problema ngayon is the understaffing. So, increased risk kasi siya ng miscare and errors. So, syempre, pag magkaroon ng mga miscare and errors, it will fall under negligence or either malpractice. So, what is the action for that? Is the equal distribution of the nurse-patient ratio. In the government sector, it does not happen. In the private, possibly pa. Pwede pang ma-comply namin yung nurse-patient ratio. Actually, here in Tri-City, I'm proud to say na we have an even nurse-patient ratio. Kasi here, we have the staff nurses, we have encoders, we have nursing attendants, and in orderly in place per unit. So, para hindi mahirapan yung nurses natin. So, meron na kaming mga other allied helpers para tumulong sa nurses. Unlike on the government side, mostly one nurse is to ward, one nurse is to 25 patient, one nurse is to 50. The most or the maximum patients that we have here in Tri-City is 1 is to 10 or 1 is to 8. That's the maximum that they have in the wards. So, and then proper delegation ng mga supervisors. Again, babalikan ko yung legal responsibility natin. Kapag hindi ka confident dun sa pinapagawa or dun sa dinadelegate ng supervisor mo, you have the right to refuse. Pero within your ano naman, yung capability. Okay? Next slide po. Where a person is injured or property damage threatening the patient, visitor, or staff safety. So, yung mga nasabi ko po sa inyo kanina na samples ng negligence, yung mga potential for legal issues, yung mga malpractices, ginagawan po ng incident report. Bakit po? So, yung incident report po is, a documentation wherein kung ano yung nangyari sa incident. Also kasi, actually allergic ang mga nurses dito sa incident reports. Kasi akala nila pag may incident report, sila na yung may kasalanan. Most often than not, hindi. Incident reports is just a documentation kung ano yung nangyari. It could also protect the nurse on duty kung ano yung nangyari. Kasi doon sa mga incident reports na makukuha, i-investigate yon ng mga supervisors kung sino pa talaga or saan ang problem. Next part, please. So, itong process na to is based on our institution. So, this process first is the identification of incident. So, kapag si staff nagkaroon ng incident, i-report niya ito immediately sa kanyang supervisor. The supervisor will then gather data through the incident reports, dun sa documentation, and will gather his or her own investigation. So, kapag ka nagkaroon na ng investigation, ng data gathering, nagkaroon na siya ng solution, kung nagawan man ng solution, it will be reported to the chief nursing officer. By then, the chief nursing officer will have to evaluate yung mga incident reports, yung mga recommendation ni supervisor, kung ano yung mga recommendation niya na or solutions na nangyari, and then i-evaluate for corrective actions. Corrective actions naman, it will dito kasi sa amin, kung na-solve na ni nursing department, it will stay within the nursing department. But then, kapag ka meron talagang legal aspect na natamaan, I will be forwarding that to the Human Resource Department because the Human Resource Department will then evaluate the corrective action based on the legal department of the hospital. So, yun yung mga malalang malpractices na nangyayari kapag ka pinasa na po sa HR. But then, yung mga negligence part, sometimes, nandun lang yun sa nursing. So, nasa chief nurse, mostly lang yun, nasa nursing department lang. And magsasuggest na lang ako ng corrective action. So, sa amin, next part please. Ano yung mga corrective actions? Ito yung mga most common na corrective action. First offense is kakausapin mo, iko-coach mo ang staff. Verbal warning. Then, the second offense na ginawa niyo ulit yun, there will be a written warning already and it will be filed under 201 files. So, it could affect yung inyong mga recommendation reports. Third offense, there will be suspensions until on the fifth offense. So, depende po yun sa gravity na ng offense na ginawa ng nurse. The final offense or kung paulit-ulit na until sixth is the dismissal already. Actually po, sa handbook namin, yung mga malpractices po, yung mga medication error, blood transfusion error, surgical error, mga errors leading to permanent damage and to death is immediately dismissal of the nurse. Pero it will undergo process, yung process po na pinakita ko sa inyo kanina, the nurse will undergo that process muna bago naman mapatawag ng dismissal. Kasi under the nursing department, ayoko din naman nun. So, I am looking for solutions, not the nurse, para hindi ma-dismiss yung nurse. So, ang nangyayari po dyan, it will undergo due process. Actually, on our part, we have the legal team. So, we have what we call the administrative hearing. So, kapag ka mga malala po talaga yung mga nagawa na offense, mag-undergo ng administrative hearing with the legal department or the lawyers of our institution. Then afterwards of that hearing, dun po magkakaroon ng solution or resolution kung ano po talaga yung mabibigay na sanctions sa nurses. So far po, dito naman sa akin, yes, sir. Malpractices usually arise from training that are not effective. Yes, sir. That's correct po. So, it will fall pa rin under the training of the nurses. Yes, may due process. Yes po. So, hindi naman siya immediately i-dismiss. Ayun nga, katulad nga doon, may process tayo, may investigation si nursing muna. Pagkatapos ni nursing, magkakaroon ako ng evaluation, magkakaroon ako ng recommendation. Pero syempre, hindi dismissal yun. Tapos, mag-undergo ng administrative hearing. After that, magkakaroon ng solution. So far nga po, since I was promoted po kasi as chief nurse last December lang. Pero I was supervisor already for almost 4 years in the operating room. So, so far naman po wala pa kami nadi-dismiss na nurses this year. Hopefully, it will continue. Meron lang mga minor sanction, mga verbal written warning. But then, thank you, sir. So, hopefully, mapapatuloy namin. So, next part. So, to avoid mga legal issues natin, it is crucial to recognize yung mga kanina na sinabi ko nga, yung mga potential na red flags or signs. Steps like thorough documentation, the clear communication, and ensuring informed consents go a long way in preventing legal complications. So, if a situation arises or if an incident arises and you're unsure about yung mga legality, mga scopes niya, kunyari may mga incident kayo tapos unsure kayo sa mga legal aspects, you have to consult with your immediate supervisor. Kami naman sa managerial part, sa supervisor, we are really helping our staff para naman hindi sila magkaroon ng mga corrective action. As much as possible, we do not want yung anong bang tawag doon? Military style or kamay na bakal as much as possible. So we go through coachings, communications, muna. Pero afterwards talaga, if hindi talaga sumusunod ang staff, that's the time yung kamay na bakal. Okay? So by taking this proactive measure, we can avoid misunderstanding, we can also protect our careers, and also syempre yung patient natin. Again, ang priority natin is yung patient's safety and care. Okay? So according to the nursing law, or the RA 9173, these are the grounds. Punitive approach. Opo. Sorry, sir. So, according to the RA 9173, these are the clauses for revocation and suspension of license. So, if you had for unprofessional or unethical conduct, you had a malpractice or negligence in nursing, for use of fraud, deceit, or false statements in obtaining the license, so peking, lisensya, marami sa recto nun. Pwede kayong magpagawa. Pero wag niyong gagawin kasi hindi maganda. For violation of this act, the rules and regulation, code of ethics for nurses and ethical standards for nursing practice, policies of the board and commission, or condition limitation or temporary special permit. So yung mga namimeki po ng mga certificates, mga IDs, yung mga licenses, it will fall under this one. Also for practicing by his or her profession during the suspension of the practice. So ito po yung mga clauses ng under ng revocation and suspension of license. Again, hindi naman din po immediately nagsususpend or nag-revoke ng lisensya ng nurse. Again, merong due process palagi bago pa magkaroon talaga ng final decision. Okay? Now, as stated kanina, di ba, there have penal provisions. So, can you proceed to the next slide? So, sa penal provisions, this will go, ito din po yung mga clauses para magkaroon ng parang corrective actions or revocation or suspension of licenses. So, isa po is without a certificate of registration or license. Also, who uses his or her own certificate for another person, hindi din po siya pwede. Who uses an invalid certificate of registration or license, yung mga expired, canceled, or yung mga temporary permit. So, it will fall under the revocation suspension of the license. Who also gives any false evidence to the board in order to obtain a certificate. So, di ba po, bago tayo maging nurse, meron po tayong mga pinapasa sa Board of Nursing or sa PRC para po mag-qualify tayo. So, kung pineki po yun, magkakaroon po ng parang sanction for that. Also, who appends or uses yung BSN or yung RN ng mga initials nang hindi pa naman nila nakukuha yung degree na yun. Meron din po siyang, under din po siya sa provision na to. Also, who a registered nurse or licensed nurse who assists in illegal practice of a person. So, isa po to sa mga penal. Ito po yung mga samples sa law mismo natin na pwedeng ma-revoke or suspend ang ating mga lisensya. So, what are the sanctions under this one? Next po, please. So, the penal provisions, yung mga sinabi ko kanina, there will be a fine of 50,000 pesos to more than 100,000 pesos. Or, you can be imprisoned for 1 to 6 years or more. So, yun nga. So, yung ating nursing law kasi, katulad nga sinabi ko po kanina, it serves as our compass in our nursing practice. May it be here in the Philippines or in the other countries, it helps us or it guides us kung ano yung tamang kailangan gawin natin. And then, sa mga posibleng maling gawa, meron talagang kakibat na consequences, which are this one. So, in conclusion, no, understanding this legal aspect is essential for safe and effective practices. So, by following this code of ethics, respecting our patient privacy, and recognizing potential legal issues, we can uphold the standards of nursing and protect the people we care for. We protect our licenses. We do our job right. We given the quality care that our patients expected. So by reinforcing this or by understanding our law and committing to the ethical practice, we ensure that we deliver the high quality care that we given by safeguarding the rights and dignity of those we serve. So let us remember that our roles are not just about administering medication or performing procedures. We are patient advocates, we are educators, and we are the guardians of our patients' well-being. So by maintaining our high standards in our practice, we protect our patients and ourselves, fostering an environment of trust and excellence in the healthcare.